Welcome back to a new episode of Reclaiming My Mind. I'm your host, Jessica Vaughn, and we actually have a co-host today joining us, and someone who's actually going to work more on our podcast, and you'll get to hear a lot more of his voice, is Kin Cook. Welcome, Kin.
Oh, thank you very much.
Tell me a little bit about why you want to get involved or about yourself in general.
Well, I guess a couple of reasons. Number one is I have gotten involved with progressive movement more, and I think this is an excellent way to get the voice of the progressives out to the world, if you will. Having been, I am retired, so that gives me a lot of time. So I have some extra times to put forward to projects like this. So that's, I guess, the two reasons. I guess the third is, frankly, I'm trying to make a better world for my grandchildren.
Aww.
I mean, that's the reason that I've gotten quite involved and getting more involved, because I think we've got to look out for their interests.
Great. And Kin really pushed to make this podcast episode happen, so thank you so much. He's kind of pushing us along to get things started for the new year. And today we're going to be talking about Medicare for All, and we're lucky enough to have with us a local healthcare worker, as well as an activist who's been working to help educate and get universal healthcare on the forefront of Tampa Bay. Cris Carlson, welcome so much to the show. Thank you for being here.
Of course. I'm happy to be here. Thank you for having me. I'm flattered.
We had Cris at the Progressive Caucus meeting, and he did a presentation that was fantastic. And we wanted to open it up to have some more conversation about Medicare for All. So we invited him, and luckily he accepted. Tell us a little bit about your background and what drew you to kind of be an activist for universal health care and Medicare for All?
Sure. I think in some sense, when it comes to healthcare activism, I kind of have it easy because it's a great unifier. I mean, I think for that reason, we've all kind of experienced our own journey with the American healthcare system. And so I guess the beginning of it for me was my family and my family having to go through all kinds of financial and personal issues related to healthcare problems. And as a result, that made a deep impact on my life. And I would say is probably one of the main reasons why I got interested in politics. So that's kind of how it began for me. But also now I mean, I'm interested in the fight for Medicare for all for professional reasons, for personal reasons, and for political reasons. So for all of those reasons, I kind of got involved in the fight, I guess.
Now, you're a healthcare worker, so you work in the medical healthcare. I mean, the mental.
Yeah, so right now I'm a social work student. I'm a social work intern at an inpatient psychiatric facility, and I'm also an administrative assistant, they call it, at another inpatient psychiatric facility. And then I also am a social work director for undergraduate students for a clinic at USF. So I'm in an outpatient setting, and I'm in an inpatient setting right now. So doing a lot of stuff.
And then you're also with an organization, right, that pushes for educating and pushing our politicians towards supporting universal health care or single-payer health care, which is called Tampa Bay Medicare for All Coalition, right?
Yes.
Can you tell me a little bit about that?
Sure. So the Tampa Bay Medicare for All Coalition is a coalition of a variety of organizations in the Tampa Bay area. I would say that it emerged out of a rally we had outside of Kathy Castor's office that was originally organized by Progressive Democrats of America, National Nurses United, Tampa Bay Democratic Socialists of America, and Our Revolution. And out of that, we managed to have a rally outside of Kathy Castor's office to pressure her into signing on to the House single payer bill. There was about 70 or so people there. And after it ended, we all thought, hey, let's get together and actively kind of meet, have meetings and see what we can do. And so now we meet monthly. We kind of started, I think, in October 2019. So we're still kind of new and fresh. But we've recently had an educational event at a library called Runaway Inequality, discussing how income inequality and the problems in healthcare are definitely related, how our healthcare system perpetuates income inequality. In the future, we're going to have a film screening. And we're also involved in trying to pressure Kathy Castro to endorse single-payer health care. So we're kind of brainstorming ideas on how to do that, although recently she's endorsed Joe Biden, so that's made our work locally very difficult.
So for people who may not be that politically involved, Kathy Castor is the House of Representatives on a national level for District 14, which mostly makes up Tampa Bay area, right? Most people. I'm in New Tampa, but I was gerrymandered into 14. I was originally 15, so we're all kind of being funneled into her district who live kind of centrally in Tampa. And she's, like I said, our representative on the national level for the House of Representatives. Okay, and then the one last thing I kind of want to ask you about into our intro is you're also involved in what we would say the acronym DSA, which is Democratic Socialists for America.
Yes.
Tell me just a little bit about that organization. Is that a political party? What is its, kind of mission statement and how active it is locally?
Sure. No, DSA is not a political party. We're actually a 501c3 nonprofit organization. I guess you could call us kind of dues-paying socialist institution, so to speak. And one of the reasons why I joined DSA was because of Medicare for All, and it's a main plank in DSA National's platform. But beyond that, DSA is also a socialist organization, and I would consider myself a socialist. So that combination definitely drew me to DSA. Right now, I'm the co-chair of Tampa DSA's Health Justice Working Group. So locally, DSA, right now in Tampa, we more or less have two functioning working groups. We have a political/electoral working group, and they're doing work for Bernie, canvassing, phone banking, sign waving events, a variety of other things. And then we have the Health Justice Working Group, which has been involved in mostly the fight for Medicare for All, also doing canvassing, also trying to pressure politicians. And the DSA's Health Justice Working Group is part of the coalition too. So
okay, well, I want to talk more about that and the difference between socialism and democratic socialism, but I want to make sure we have a bulk of actually talking about our topic, which is healthcare. So we're going to cover that first. Ken, did you have anything that you wanted to add right now?
Not yet.
Okay. I want to make sure I don't leave him out. Okay, so right now, in the presidential election, because I want to kind of focus on that because that's where the debate's going to be on the national level, we've narrowed it down to pretty much two candidates. Sorry, Tulsi, we're not counting you as a valid candidate. I know that's going to inflame a lot of people, but right now you're not on the stage. So we've narrowed it down to Bernie Sanders and Joe Biden, who are extremely different, especially when you're talking about access to healthcare and what their healthcare platform is going to look like. So I want voters to have an informed, plan for understanding when they're going out to vote what that means for healthcare all around. So when I Googled Joe Biden's healthcare plan, essentially all that I saw under his platform was protecting and expanding the Affordable Health Care Act. So we can pretty much say basically just making healthcare or the Affordable Health Care Act maybe a little more strong and giving a little more access to people based on what he has on his platform. Then on the other hand, you have Bernie Sanders, who wants to introduce, and I believe it's over, Ken and I were talking maybe 4 or 5 years, transition to the Medicare for All plan, which now let me back up a little bit. When we talk about Medicare for All and we talk about single payer and universal health care, are all these terms interchangeable, or are there distinctions between the two, and what should we be using?
Well, I wish in American political discourse they were interchangeable, but unfortunately right now I think largely in part due to the Democratic Party, they're not. And a lot of Democratic presidential candidates have been trying to sing Bernie Sanders' song when it comes to Medicare for All, but then their proposals don't ultimately end up actually being single-payer universal health care proposals. So I guess like Pete Buttigieg is notorious for having previously stated that he supported Medicare for All. Then he's kind of backtracking on that, using Medicare for All terminology, but framing it in terms of Medicare for all who want it. And essentially it's just a public option, and it has nothing nothing to do with single-payer healthcare at all, nor is it universal healthcare. So that's definitely a major issue. But I would say that as a single-payer activist, I think the Medicare for All terminology is a good thing because people know family members that are on Medicare. And I think Medicare is the strongest insurance institution in the United States. So when we say Medicare for All, that's language that people can connect to. But when I talk about Medicare for All, and I think historically when people talk about Medicare for All, what they're talking about is a single-payer insurance system. One payer, a federal program run by the government that all people pay into, and then as a result, you get healthcare free at the point of service that's comprehensive.
Okay. And we have some listener questions, so we'll get into the nuts and the bolts of that. But let's talk about the Affordable Health Care Act first of all. So in my experience, and I mean personally trying to access affordable healthcare network, as well as having lots of friends and family, one of the challenges were the price point. Is that, at first it started off somewhat affordable, and then as time went on, it seemed like the plans got even more expensive and they covered less. And a lot of people I know who felt very frustrated when they were involved in the 2016 election is they actually felt kind of burned by what they would call, in quotations, Obamacare, Affordable Health Care Act, because with the insurance companies dictating so much of those plans and what that looked like and the price point, it really wasn't, even though it might have offered more access to health care to people who weren't able to sign up for it before. And for people who could afford the subsidies, it did make it more affordable. But for those of us who kind of fell in that actual middle class and didn't qualify for subsidies, but still needed access to that health care for whatever reason, some plans could be upward of $400 to $500 a month with giant deductibles, huge co-pays, a lot of money to see specialists. So what do you think was one of the biggest challenges or one of the biggest problems in structuring the Affordable Health Care Act, and why it left so many Americans feeling kind of burned?
Well, we could talk about the ACA for a long time. Massive legislation. But how I would respond to the ACA is this. I think most people don't realize that the expansion of insurance coverage under the ACA happened mostly through Medicaid expansion, not through the marketplace exchange. So I think about 2/3 of people who ended up gaining insurance as a result of the ACA gained it through Medicaid expansion.
Okay, that's good.
And I think Medicaid expansion is by far the best aspect of the ACA. That's the strongest part of it. And then, the ACA also created essential health benefits. So it kind of standardized care federally to ensure that insurance plans had a minimum standard of coverage. So then junk plans kind of in a lot of ways got eliminated. And then, of course, the ACA had that pre-existing condition clause. So if you had pre-existing conditions, insurance companies couldn't deny you. That's all good. The huge disaster of the ACA is the marketplace exchange, which is originally a conservative idea emerging from conservative think tanks, and actually was proposed by a conservative senator in 1994. I forget his name. But the marketplace exchange is more or less a plea bargain with private health insurance companies saying, pretty, please, insure all these people if you can, please, and we'll give you a whole bunch of subsidies so that we can make it profitable for you to insure people who don't have that much money. So the marketplace, in a lot of ways, is just a massive kind of subsidization of private health insurance companies. And since it's voluntary, it's something that you kind of can choose to purchase, so to speak. There's some issues with that. Like originally, the Congressional Budget Office predicted that 22 million people would sign up for health insurance through the ACA. In reality, it ended up being more or less half of that amount. So because there's that kind of like, you have to put the work on yourself to go and find yourself a plan.
Right.
A lot of people didn't really like that too much. And then on top of that, it's extremely confusing.
It is.
It's shopping. You have to do a cost-benefit analysis, shopping around for various plans. Comparing, what kind of income you make versus how much of a subsidy you're going to get. And then there's the gold plans, there's the silver plans, there's the bronze plans, and it's just absolute insanity, in my opinion. And then you have to figure out what's in network, what's out of network.
Right.
And I think a lot of people, when they go on the marketplace, they feel stupid because they have no idea what they're doing. And then I think a lot of people, as a result, think that that's their fault. Like, oh, I don't really understand this. I thought this was like a good thing. I've heard this from Democrats that loved Obama and supported the ACA, but then when they actually have to go sign up for an insurance plan, they feel confused. But you're not stupid. The system, the marketplace is stupid. It's not you. It's how we're managing healthcare, and it doesn't have to be confusing.
Well, but that's probably part of it, as you pointed out. I mean, this was a compromised system. I mean, it put more people on insurance. It gave them more opportunity to get insurance. But we haven't seen a lot of better health care options or better health care. We're still falling way behind a lot of other countries who have much better outcomes from their system, which is more universal type coverage. So I think you make a good point. The system is so complicated that it is full of I don't know, unable or inequities, number one, and it's an expensive system because of all the administrative side of it.
Right.
So the ACA, like you say, was just a compromise to get something through. And as you can see, it's been attacked constantly from the GOP
But I will say, I think it was a huge factor in a lot of people when they were deciding who they were going to support in president, in my experience. People who, might not even have a party affiliation, who might be an NPA, felt really misled by the fact that they were promised health care, and then weren't able to access it or face the challenges that you've mentioned. So it sounds like what we've identified is it offered a lot more access for Medicare patients.
Medicaid expansion.
Medicaid expansion, which was good.
Although Florida, of course, didn't expand it because of
Rick Scott.
our wonderful Republican legislators.
Who's now our senator, right?
Yeah.
But as a marketplace plan for the people who were looking to have to purchase it as an alternative, maybe for pre-existing conditions, or because, like my husband, who has a very small company and isn't provided that kind of corporate rate, it was maybe not as accessible as we were hoping, and very convoluted and not user-friendly and confusing.
Yeah, and expensive. Which always creates barriers to care.
Right.
And then at the end of the day, that means people die.
Oh, my goodness. Well, so let's talk about transition into, you had mentioned that one of the reasons you like Medicare for All is because people identify with Medicare already and they understand that that's a framework that we already have. But one of the things that I hear a pushback from is that the Medicare that we have now is really not like what we're talking about when we talk about Medicare for All, because for seniors or people with disabilities who have Medicare, really it's a framework that covers a portion of it, right? You have usually 80% covered. There's 20% that falls on you. Or you can buy a supplemental insurance policy through private insurance companies that might make it where you don't have to pay anything, but then you're managed more like an HMO and you have less choice in what you're able to access. So in one way or another, if you want the freedom, you have to pay for it, or if you want to be able to have it be completely free, which a lot of seniors need to do, they're then going through a managed healthcare system that provides a lot of bottlenecks on the access that they can get. So this would be different, right? And it would also cover more. Let's talk about what Medicare for All would actually look like and what it would cover.
Sure. Yeah. So I'll just be honest. Yeah, Medicare as it exists right now is a mess, and it's expensive. And there's 4 parts to it: Part A, Part B, Part C, and Part D. And then with Part C through Medicare Advantage, now insurance plans that were originally run by the government are being contracted out to private health insurance companies. And there's all kinds of out-of-pocket expenses that you have to pay in Medicare depending on what aspect of it you have. So there's still copays sometimes with Medicare. There's still deductibles in a sense. There's still premiums. There's still limits on care. And with Medicare for All, we don't want to just give people Medicare as it exists now to everybody. We want Medicare to be extremely simple in a sense and comprehensive, so that all medically necessary needs you may have can be met by the program. So right now, Medicare famously doesn't cover hearing aids or eyeglasses. We want that to happen. Medicare doesn't necessarily cover dental care. We want that to happen. We want all care for all people. That's the kind of phrasing. And that's what Medicare for all would accomplish in a way that Medicare doesn't accomplish right now. It would be fully comprehensive. And there wouldn't be any out-of-pocket expenses, no copays, no deductibles, no premiums, free at the point of service.
So I think that dental is very important. I think also an aspect of it, especially for you who works in the mental health care industry, right, is we have so much focus, especially when we talk about like restricting gun laws, or when we're talking about, just on a large scale, what a mental health crisis we have in America, right, and how many people who really need access to mental health care can't access it because it's expensive, or they don't have insurance and they can't get the help that they need. Right. So I think one important part is, while dental is absolutely imperative for health, and so are hearing aids, especially with someone who has an elderly parent who's facing both of how she's going to pay for those on Medicare, access to mental health care would be transformative in this country. Yes. When we talk about who has access to it now and who doesn't, and what that looks like. So for a lot of listeners, I got questions about that piece specifically. Sure. Can you tell me that would make sure that we offer more access to mental health care for voters and for patients?
Yes, it would. I mean, I work in the psych field, I guess you could say, inpatient psychiatric settings, and I can't tell you how often I see insurance-related issues creating barriers to care. So in an inpatient psychiatric setting, where I'm at, I see a lot of houseless patients that don't have insurance, and oftentimes they'll come in through the psychiatric emergency rooms saying that they're suicidal. They want to kill themselves, or they'll be presenting kind of with like a psychotic breakdown or psychosis of sorts, but they don't have insurance. And where I work, we do accept the uninsured. But once they get discharged from the inpatient setting, they really have nowhere to go because of insurance. Nothing will cover like an intensive outpatient. Nothing will cover just regular outpatient services. Nothing will cover residential treatment if that's what's indicated. So a lot of times uninsured people will come in through the institution I'm working in, the inpatient psychiatric facility. Then they'll get discharged to an emergency shelter because their insurance won't cover any other levels of care. And then they end up right back in the psych ward again. And this just happens over and over and over and over again.
And for some patients, just access to pharmaceutical care can make a huge difference in their health care and their mental health care needs, right? Right.
Yeah. So oftentimes, people will get discharged from an inpatient psych setting, and they'll be referred to these outpatient services, but they can't afford to pay for their prescriptions.
Sure.
Because their insurance doesn't cover it. So they don't have that regular continued care that they desperately need. I mean, with mental health, one of the main issues with it is it's not really profitable. It's not really a profitable industry, because mental health often is a chronic kind of long-term issue with no, quote, cure, so to speak. Sure. So it requires long-term management. It requires regularly seeing a therapist and a psychiatrist. And really, at this point in the United States, the main driver in profits for mental health is unfortunately pharmaceuticals. Mm-hmm. So psychiatry has more or less become a practice of medication management, and that's kind of it. There's no fancy technology necessarily. There's no fancy procedures. Yeah. There's not really a lot of money that you can make off of it outside of pharmaceuticals. But a lot of people, because the prescription costs in this country are so outrageous, aren't able to afford their medications. So, I mean, these are some of the major issues that I see working in mental health.
So I think that, from what I'm hearing is, access to healthcare for everyone, even our most marginalized, doesn't necessarily translate to just benefiting that specific person, but that holistically as a society, as a community, being able to make sure that everyone can access healthcare affects us all collectively, right? Having healthy citizens who can have access that they need lifts us all up together as opposed to just maybe one individual. So here's the big question, right? Did you have a question, Ken?
Well, I was just going to follow up a little bit on what you're saying. I mean, what we're seeing out in the rest of the world who has some type of universal system, they're not all what Medicare for All is, but what we're seeing is much better outcomes, medical outcomes, in all of these countries. I mean, something that I think people need to understand is that we always want to think America's the best, U.S. is the best, but in this area we aren't. Well, if you look at the outcomes, the medical outcomes that are happening, opposed to us, our system we have, as opposed to some type of universal system.
Well, I would say one of the main reasons for that is in the United States, we're really lacking primary care infrastructure. And that's one reason why I would say our system is really focused kind of on acute care.
Right.
Like hospitalization or doing procedures or you don't in this country, getting a primary care physician is somewhat difficult. We don't have too many primary care physicians comparative to a lot of other countries. And so people don't regularly see doctors all the time. They only generally see doctors if there's some kind of an emergency or if they're fortunate enough to have the luxury to be able to afford to see a primary care physician. And that's a long conversation, but I mean, the United States, the medical system really emphasizes specialization. If you become a doctor, there's not enough primary care in this country. And so, I hate to mention Cuba, but Cuba has higher life expectancy rates than the United States. Cuba has better infant mortality and maternal mortality outcomes than the United States. And the main reason for that, despite being an extremely poor country that has limited resources, they emphasize primary care dramatically compared to the United States. They have so many more primary care physicians than we do per capita, and people in Cuba regularly see a doctor without having to worry about affording costs. And when you see doctors all the time, regularly, it's a preventative way to help people with their health.
But is it profitable?
Not necessarily.
No. But you see those same outcomes in other countries, Germany, France, Canada. All of them have longer life expectancies. All of them have lower infant mortality, also lower maternal deaths based on their system. And so I guess that's one of the things that I see is going to Medicare for All, that we would improve those outcomes. I think that it would make not only marginal people's but just all of us.
Yes, exactly.
Better.
All of us.
As you had pointed out, bringing everyone to the same level of medical care and everything else helps our whole society in so many different ways. And all the studies have shown that it's cheaper. So,
let's segue into that, right? Then when we are talking about Medicare for All, people's concerns, and that's a lot of what we want to address specifically here, is how are we going to pay for this, right? That's everybody's concern. It's so expensive. When you watch the debates, a lot of people will hammer away on Sanders. This is going to be such an unaffordable, $4 trillion, I think was the number that I heard, transition. So let's talk about that, because that's a huge fear and a barrier to people. How are we proposing that we're going to pay for something like this?
Sure. So, so right now, if you look at the numbers, we spend, I think it's about $3.8 trillion a year on our healthcare system. And we pay twice as much per capita than any other comparable country in the world. And 1/3 of all of those healthcare costs are administrative. And then if you dig deeper, 2/3 of all of our healthcare costs are actually tax financed. So when you think of these numbers, it's not necessarily how are we going to pay for it. It's like why are we why is so much money going to administrative costs? Why are we per capita paying twice as much as any other comparable country? Why are we wasting all of this money?
Right.
Because in a lot of ways we are financing a massive healthcare system, but we're not getting universal healthcare as a result. We're paying far more than we should be paying for a healthcare system, and in return, we're not even getting universal healthcare.
Right.
That's the huge issue. So it's not whether or not we have the money to be able to afford a single payer system, because if you read any kind of study that does an honest assessment of single payer healthcare, you're going to find that it saves trillions and trillions of dollars over the long run. I mean, even conservative think tanks that have done studies trying to throw Medicare for all under the bus end up having to admit, the system is going to save money. I mean, if you look at CMS's predictions, the Center for Medicare and Medicaid Services, they predict the system as it exists now over the next 10 years is going to cost us around $50 or so trillion. Mm-hmm. And if you look at all the studies that have been done, there's a recent one in the Lancet, Medicare for all system over the next 10 years would maybe cost around $42 trillion. Mm-hmm. So $43 trillion. It kind of depends on what study you're looking at. But I mean, the main point is a Medicare for all system is elegant and it's simple, and it dramatically reduces administrative costs, and it provides preventative care in a way that our system currently doesn't. And I think those mechanisms are what's going to save money, because people are no longer going to be afraid to go see a doctor. So if they have some kind of issue going on, they have some kind of pain in their chest, that's not going to become a ticking time bomb that eventually explodes and someone goes to an emergency room and then has to have an extremely expensive procedure. They can easily just make an appointment with their primary care physician, not have to worry about out-of-pocket expenses, and they can just immediately see a doctor 5 years before this thing explodes into something that becomes a huge health concern that costs a lot of money. So, I mean, how are we going to pay for it? Bernie Sanders released a white page many years ago when he first proposed his legislation in the Senate. I mean, the simple answer is we're going to implement a payroll tax, and then we're also going to tax the rich.
So what I'm hearing is there's a lot of, administration costs that will be cut down, and over a longer period, we'll have less costs associated. But you said something about a payroll tax. Mm-hmm. And I think that's what voters are concerned about, is that they're concerned, especially like middle class and working class voters, that this is actually going to cost them more in the long run, or that it's going to somehow cost our government funds where it should be going somewhere else. When I think about it, I think about like this giant military budget that maybe we could reallocate some funds. But when you talk about these extra taxes, a payroll tax and a wealth tax, what does that really come down to?
Bernie just released kind of a how am I going to pay for my plans section on his website. And when it comes to Medicare for all, he wants to implement a 7.5% employer payroll tax. As a percentage of your income. Does
that mean employers are going to pay for it, or the employees?
It'll come out of employees' paychecks.
Okay,
yeah.
7.5.
But out of that, and it's a percentage of your income.
Right,
so the more money that you make, the more money you pay into the system.
Right.
And then I believe if you make under $29,000, you're not going to be really affected by that much at all. So people are going to be paying into the system. This is everybody paying into one system so that everybody can have healthcare free at the point of service with no out-of-pocket expenses, no exceptions. And in the long run, that's going to save people so much money. You'll have to pay a little more into the system, but what you get out of it is comprehensive healthcare. You never have to worry about paying for any kind of healthcare procedure or seeing a doctor. And if you just look at the numbers, that's going to save so many families so much money. I think like right now, a middle class family on average spends around I mean, it's upwards of $8,000 to $20,000 on healthcare a year,
right.
and that'll be cut down dramatically to, I mean, depending on someone's income, maybe $2,000 a year, $3,000 a year. So the question is always like, oh, is it cheaper for me to pay $8,000 a year for my family's healthcare, or would it be better if I only paid $2,000 a year under a Medicare for all system, even though my payroll taxes have gone up a little bit? I mean, it's not hard to do the math there. You're going to save thousands of dollars.
So it's really a shifting of cost and reduction of cost at the same time. Mm-hmm. We hear a lot of people hear tax, and suddenly they don't want to deal with that. They don't want any mm-hmm. taxes going up. Mm-hmm. But the fact is that the studies have shown mm-hmm. that they've done is that you will reduce your overall costs for health care
right.
by going to this plan.
Yeah.
And I think that's something people need to understand is you cut out all these other expenses mm-hmm. under this plan. You get the coverage and health coverage that you need. It's portable. You're not dependent on anyone else like your employer for mm-hmm. the type of coverage that you have. Mm-hmm. And so it's not costing you more. It's just shifting the cost into a different format.
Yeah, and I mean, one way I would frame it now, any out-of-pocket expense that you're spending on healthcare right now is a tax.
Right, that's a good point.
I mean, a copay is a tax,
right.
so to speak. I mean, a premium is a monthly tax. You're just paying these to, your doctor's office, or you're paying these to your insurance company. All of these out-of-pocket expenses right now, you could more or less just call a tax on somebody's health.
Right.
So, I mean, I think it's more kind of like a framing issue here. And yeah, the Republicans and some conservatives and even some moderates will exploit the word tax because people don't want to pay more taxes, and that's a horrible thing. But it's like, if you look at the healthcare system as it exists now, right. people are paying enormous amounts of money out of pocket. And for all intents and purposes, they're being taxed. They're just not being necessarily taxed by the government. They're being taxed by healthcare institutions or health insurance companies.
So here's where it leads me to think about and how we have to, or anybody who's invested in Medicare for all has to frame it. Because there's a lot of people who will hear that and say, well, that doesn't really apply to me. I already have great health care insurance. Mm-hmm. I don't pay a lot of premiums. I'm one of the lucky people. I work for a great company that's provided that, or I'm a union member that's negotiated that as part of my benefits for so long. But where I think the disconnect comes in again, right, is how other people's access to health care affects your life. And we're looking at that right now with the coronavirus, right? This is a pandemic that is sweeping across the entire world. And then, so maybe you're safe, right? And you have access to healthcare, and that's all great. But if the people around you don't have that access, if they can't afford that, and we have a pandemic where everybody's, at risk for being sick, mm-hmm. what that does is that increases the likelihood that you're going to come in contact or that you're more exposed because the people around you don't have access to health care, can't take off time to go, see the doctor, can't stop whatever they need to do to focus on their health. So I think that's the problem, is a lot of people think, well, I'm covered, I'm okay, I have insurance, I don't need to pay extra money. And you're saying, well, we all need to pay a little bit extra so we can all be covered, but not everybody sees the benefit of everybody being covered and how that individually affects them on a whole. Mm-hmm. So I think that's one thing that we have to talk about, is why it's important for us all equally to have health care, because the public is all connected by health, right? If one of us is sick or if something happens, it's not anything that we can protect with wealth from getting sick. You might be able to have more access to getting better or diagnosing something, but we're all connected publicly through the health sphere, right? Yeah. And so if there are lots of people who don't have access to healthcare, it's really putting you at bigger risk in a pandemic situation.
Well, not only that, but it's also running businesses' costs up. Mm-hmm. People are out of work more.
Right.
You're seeing, and that's kind of something I'd like to address too, is as a business or a business person who owns a business, why should they care about Medicare for all?
Well, yeah, we're talking Corona businesses. A lot there. No, it's fine. I mean, I think it's outrageous that 50% or more of people in this country are insured through their employer. And I think it's outrageous that for whatever reason, businesses and employers, the burden of providing people with health insurance has been placed onto them, because that really doesn't make any sense at all. You ask any person who runs a small business, is it fun to deal with health insurance for my employees? No, it is absolutely not. And ask any person who runs a small business, is it expensive to provide health insurance to my employees? Absolutely it is. Right. So navigating the bureaucracy and then the costs associated with that are a tremendous burden on small businesses, or really any business owner. I mean, there's an organization called Business Leaders for Medicare for All. And you can go check out what they're up to. I forget the name of the person who runs it, but he's some kind of CEO. He has hundreds of millions of dollars, and even he is extremely flustered at having to deal with health insurance for his company and his employees. So I think dislocating healthcare from your employer is a really good idea, not just for employees, but also for people that run businesses too, because they're going to save a lot of money and a lot of time not having to deal with health insurance. So, I mean, that would just be kind of my initial response to that question.
Plus, I feel like it would promote smaller businesses, because there are so many people right now that stay in the corporate world or that are tied to a specific job simply because of access to healthcare, and they can't go out and they can't start their own business or do what they feel passionate about because they're tied to this healthcare. I mean, family members specifically. So I think that overall, if people didn't, like you say, have to rely on being tied to their healthcare through their job, we would see so many more small businesses open and have the support that they need, or people being willing to take that chance or change their lives because they're not making all their decisions about where they can get access to healthcare.
Yeah, go ahead, Chris.
No, and I mean, I always want to think of it from a worker's perspective too. In many ways in this country, health insurance is used by businesses and employers to dominate their employees. And it's kind of an oppressive system. Say that you're an employee of a company and you really hate where you work. Say it's a discriminatory workplace. Say you're not getting paid much money, but this job provides you with health insurance. Right. You have an incentive to stay in this oppressive environment and not to find another job that you would enjoy better, that would be more fulfilling, because this job you currently have provides you with health insurance. Yeah. And say you have a chronic issue, that becomes a serious concern. Absolutely. Or say you're in an abusive relationship, and you rely on your partner for health insurance through their job. Yep. You're not going to want to maybe leave that relationship because you rely so heavily on that person's health insurance that they get through their employer.
And people might think that's a jump, but I know some people like that right now in that exact same situation.
And this has been going on for a very long time. And it's, I think, this idea of portability. That you can move from job to whatever job you want to, you can better fulfill your life, has certainly become more important. Well, it's become more important to people, number one. And this offers that opportunity so that they are not tied. And I will tell you that if whatever your employer is doing now, they may not be doing next week. Right. Okay, so you don't know that you're going to have great coverage.
That's for sure.
And the second thing is, you don't even know if you're going to be employed with them next week.
Right.
This is something I happen to work with people, helping them in their interview presentations and stuff. So I see a lot of this. People losing their jobs. It happened to me, 20 years with one organization. The next day I wasn't there. So they gave me a COBRA form to fill out for my health care.
Oh, COBRA's a nightmare.
and my cost tripled until I could find work again.
Yeah. So what I'm hearing is it's giving people more choice. Because, right, that's a key word here that we have to overcome. And there are two other issues I want to make sure we get to that I've heard a lot of people talk about. But one, we've talked about how Buttigieg kind of transferred from, or pivoted from kind of being a supporter of Medicare for all, and then talking about this choice plan, right, where you said people just get a public option and everybody has choice. And that sounds so great, right? Why wouldn't, as Americans, we want less choices for people who are like, I love my health care. Right. But for what we were talking about earlier is really choice is just, kind of a misleading term to a lot of conservative people use as they prop up the benefits of privatizing things, right? Is this illusion of choice. And what we're talking about is how Medicare for all would actually give people more choice and more options because they're not tied to their job. Tell me about plans or Pete Buttigieg's plan that talks about giving people choice and leaving insurance companies in the game, and whether we can actually really transform healthcare on the level that we're talking about if insurance companies are still allowed to dictate prices and basically make a profit from denying people access to healthcare that they've paid for, right? I mean, that's what insurance companies do. Yeah. So what happens if we leave them in the game and we expand the ACA, or we just have this choice option?
So I say we talk about Joe Biden's plan, which is more or less the same as Pete Buttigieg's plan, and it's a public option. And interestingly enough, Biden's plan is scant on details. You can go on his website and read it very, very quickly. But it's interesting that it's framed in terms of choice, because there's a lot of automatic enrollment through Biden's plan that you don't really have a choice in making at all. Say you make contact with certain institutions and you're under the 138% poverty level, you automatically get enrolled into this public option. And this public option will have copays and premiums, et cetera, et cetera. So it's almost like even in Joe Biden's plan, there's a lot of automatic enrollment mechanisms that kind of force you into having to pay for this insurance plan. And in addition, Biden also wants to bring back the individual mandate, which mandates, that's what he said, which would mandate you to purchase health insurance. So and the idea that Joe Biden and others are framing things in terms of choice seems like such a lie, because if you look at the plans, there's automatic enrollment mechanisms that you don't really have a choice in taking part of at all. But on top of that, I mean, when it comes to choice, the real question is whether or not you can see this or that doctor, or whether or not you can go to this or that hospital. Yes. Those are the choices that matter. Whether or not you can go to this or that specialist. And the public option wouldn't eliminate that. A public option, maybe you could opt into it, kind of like how you can opt into a plan through the marketplace exchange. But that doesn't necessarily mean that you're going to have choice to see what doctor you want to see, because under the public option, there's still going to be networks. You're still going to have providers that are in network with you, and you're going to have providers that are out of network. And you can't go see the providers that are out of your networks. You can only see the providers that are in your network. Exactly. So a public option, as proposed by Joe Biden, is an extremely limiting way of conceiving of healthcare. Right. So it has nothing to do with choice at all. Medicare for all would be the great argument for choice, because it allows you to see any doctor, go to any specialist or any hospital that is medically indicated to go to. Right. I mean, you can't just, under Medicare for all system, you can't just show up to a hospital and say, I would like one free surgery, please, because this is Medicare for all. Obviously there's some vetting processes, and these are decisions that are going to be made between you and your doctor. Right. But they're not going to be decisions that are made between you and your doctor and this middleman called the private health insurance companies that are actually just saying no and denying care, limiting your choices. That's how they make money. Yeah. And like this outrageous idea that, people just love all of the private health insurance choices that they have. Like, do I want Cigna, or do I want United Health, or do I want Blue Cross and Blue Shield? Oh, there's so many choices, and this is so exciting. I'm like a kid in a candy store. I mean, I have never met a single person that conceives of the choice in insurance options in that way. And I think people are more or less exploiting the idea of choice to their own ends. Right. And at the end of the day, that's just more or less being subservient to the profit-making schemes of private health insurance companies.
Well, I think the fact is that you don't have choice. Whoever you work for is making the choice. Right. Okay? Whoever the insurance company is making the choices, what doctors you will see, what pharmaceuticals they will purchase. So the idea that this system that we're currently in or Joe Biden's system doesn't offer that. No. I mean, it just doesn't. You're not making you're following whatever guidelines they put in place for your health care. You don't get to choose who you go to.
Right.
They have a network. I mean, I was in the insurance industry. That's the thing, and that's the way they make money and are able to make money is because they can control who you go to. Yes. They can control the cost and their cost with those providers, which is basically what they're doing. And not allowing people to go to the doctor of their choice to do the things.
They're limiting choices.
Yeah, and like I broke my foot a couple years ago, and I ran into this problem immediately because I need to see an orthopedic surgeon. I just broke my foot. Which orthopedic surgeons in the Tampa Bay area are in my network? Exactly. So I called my insurance company, on the couch with a broken foot, saying, hey, can you email me all of the providers that are in my network? So like, oh yeah, we'll do that immediately. They didn't do it immediately. They emailed me the next day, and then I got a list of all the providers that are supposedly in my network. And I began going down the list, calling them, and half of them, actually weren't in my network. Yeah. So my insurance company doesn't even know which providers are in network. Yeah. So even if I want to figure out what my choices really are, the burden of that work is still on me because my insurance company has no idea what they're talking about. Because when it comes to who's in network and who's out of network, oftentimes insurance companies rely on the self-reporting of the providers, and sometimes providers will leave the network without even telling the insurance company. I mean, we're getting kind of in the weeds here with that stuff, but I mean that's just like an absurd way of doing things, and that problem wouldn't be eliminated with a public option.
All right, so here's another question that I have, especially from listeners, is a lot of people are like, this is great, fantastic. Let's say Bernie Sanders wins. How are we going to pass this with the Republican-controlled Senate? Even if what are the chances of flipping the Senate? How are we actually going to get this legislation passed, even if Bernie Sanders wins the presidency, let's say?
Right. So this is a fight that is, I think, a just fight, and it could potentially be a long fight, and it has been. People have been fighting for single-payer health care since the early 1900s in this country. And yes, it's totally possible that, Bernie Sanders could get elected president, but then we either don't have the House or the Senate, so it would be impossible to get legislation passed, and then Medicare for all wouldn't happen. But that doesn't mean necessarily we shouldn't be fighting for this, because this is a moral thing that because we are human beings, we all deserve. However, I mean, if you're interested in strategy for getting single payer to happen, just by how legislation works, we need the executive branch. So I think right now,
which would be the presidency for those of us who aren't up on our civics lessons.
Yeah, if we're serious about making single payer happen, we need a president that supports single payer. It's not sufficient to just have the president supporting single payer, but it is necessary. So if we're serious about this fight, we definitely have to work on that front. We have to elect Bernie Sanders as president because he's the only person that is going to be trustworthy when it comes to this issue. He's been fighting for single payer all his life. Now, we obviously still need the House. We also still need the Senate. So what I would encourage everybody to do is to try to pressure their local representatives into signing on either the House single-payer bill or the Senate single-payer bill. That's what we have to make happen. And the only way that this is going to happen is if we have kind of a grassroots, bottom-up mass movement that makes this happen. And that's why I'm organizing locally. Right. Organize where you live. Pressure your representative. Pressure your senator to sign on to this legislation. And I think if we all do this together, and if we do it in a way that is effective and strategic and passionate and connects with human beings, I think it can happen. I mean, that's really the only way that it can happen. And that's more or less kind of how Medicare was originally created. I mean, it was conjoined in a lot of ways with the civil rights movement. It was conjoined with a lot of elderly people being outraged at the costs that they had to bear. And through a variety of fights, this question of healthcare came to the forefront, and as a result, major legislation, Medicare and Medicaid, ended up happening. So, I mean, in my opinion, we should follow kind of a path similar to the civil rights movement, where ordinary people get involved in local politics and try to pressure their representatives into making this happen.
So here are some thoughts when I hear your answer. One, personally, I prefer the word encourage, but pressure. Local politicians that could be semantics, but generally, yes, absolutely, make sure. But two, also, executive branch is really important, but at some point, this is probably going to come down to the judicial branch, right? And I think a lot of people don't understand how much influence the president has over the judicial branch of our government, in just appointees alone, right? So we can see now how Donald Trump has really taken over and shaped that branch of our government. So by Bernie Sanders being elected, let's say because of Medicare for all or being a proponent of it, one, we have the executive branch. Two, we'll have definitely more influence in the judicial branch. And I think three is that politicians who might be on the fence or who don't understand how much this issue can help carry voters would see the popularity of it, right? If we elected a president who is behind this and voters said with a majority, this is who we want, it would help the Kathy Casters or other people in the Senate or the House of Representatives who do want to be reflective of their constituency, but don't understand how popular this is with voters because maybe they're in their echo chamber or maybe they're getting huge contributions from the insurance company, see that that this is a popular idea that you can win on is why I also think that it's important. Would you agree with some of that?
No, yeah, I would completely agree with that. I mean, if you look at polling, going back decades and decades, I mean, healthcare in this country has been a number one issue for Americans for a very, very long time. Americans know that they're getting screwed over by our system, and they've known that for a very long time.
Right.
And it always ends up coming to the forefront during presidential elections. I mean, that really hasn't changed in a very long time.
Right.
And people are mad about this. And unfortunately, our political system hasn't been responsive to people's frustrations, legitimate frustrations. And yeah, I think if Bernie Sanders got elected president, I think a lot of other politicians who, in my opinion, are a little too cowardly, or they're too influenced by their corporate benefactors, so to speak, to sign on to this legislation. I think if Bernie Sanders got elected, politicians maybe like Kathy Castor would be less afraid to endorse what's right.
Right.
So yeah, that's how.
All right. So here's one last question that I want to make sure we slip in. Is a lot of people, and Ken and I talked about this actually before you came, are concerned with the effects that this would have on the job growth and the job industry There's so many people who are employed by the healthcare industry. It's a huge employment in our country. So what would happen? And a lot of people I know who are conservative Democrats have this question: how are we going to offset that huge change, that employment gap that we're going to have as we transition over? I seem to think like we'll have more opportunity for patient care and there'll be administration jobs, but just through one system as opposed to 15 different insurance companies. And I also think that like the worry of automation, when you walk into Target and you see a kiosk is just as concerning, but voters aren't as concerned about that. But in your studies, how are we going to offset the hit to the job department when it comes to transitioning over to Medicare?
So I haven't read through it yet, but I know the Economic Policy Institute just released a study on this. And again, I would recommend everybody go read it. I haven't read it yet. I should have read it before I got on here. But the argument that they made is that it would actually, under a Medicare for All system, it would actually employ more people. And create more job opportunities because there would be a need for more providers. I mean, right now, unfortunately, much of the healthcare industry industry is administrative and devoted to the health finance sector of
Right.
it. And in my opinion, that's not really healthcare at all. You're not, it's not a doctor or a nurse or a social worker or whoever else seeing a patient. It's you sitting in an office somewhere handling billing or administrative tasks or the financial aspects of the current system. And that's not really, in my opinion, healthcare at all. That's just kind of you having an office job dealing with finances, not actually seeing patients. The studies that I've read, it predicts that there's going to be job loss because a lot of those administrative jobs won't be necessary.
And they can't easily transition over to patient care because that requires more schooling.
Right. So part of the transition plan, at least in the House and in the Senate, is prioritizing these people who would lose their jobs as a result of Medicare for All into the new system. Also providing severance pay because of job loss, and then also providing education so that perhaps they could go back to school and get another profession or do something else. And I think like paired with, say, the Green New Deal, which Bernie Sanders wants to create 20 million jobs with, paired with free college tuition,
right.
We can't just think of Medicare for All in isolation from Sanders and progressives' other policies, because
Right.
I think this all kind of works together.
Absolutely.
So yeah, there's a fear that there's going to be job loss, but there's a transition plan. People that lose their jobs get first priority into the new system. They get severance pay, and there's going to be effort to make sure that they get the education they need, if necessary, to get on their feet again. And then, when thinking of it in terms of these other proposals, that I think that's a reasonable thing.
Awesome.
Well, I think too, when we're talking about job loss, we're not talking about providers leaving. Providers will still be here. You may be able to get to different providers. And as you say, more jobs in that area should open up. In addition, getting one of the problems we face is because of the profit motive, a lot of hospitals are closing, particularly in rural areas. Mm-hmm. And I think the people in those areas need to understand that this will probably make it more profitable for them the hospitals to be in those areas, as opposed to the system that we have right now.
Yeah,
so that means that they should be getting better care at reduced costs.
Well, so one of the misnomers is that under a Medicare for All system, that would mean hospitals would shut down. That's kind of been like some kind of argument. They think that hospitals will shut down because I don't all of a sudden a whole bunch of people are going to be using the hospital system, and it'll overflow hospitals, and they're all going to collapse. But I mean, if you look at hospital closures right now, most of the hospital closures in rural areas are happening in states that didn't expand Medicaid. The reason why they're closing is because they're not getting Medicaid reimbursements anymore.
Right.
So because we're curtailing our social programs, that's why hospitals are closing, because they're not getting reimbursements. So if we had a Medicare for All system, hospitals would be getting reimbursed based on the needs of their community. And there wouldn't be a whole bunch of uninsured people left out by the wayside. Everyone would have insurance. And if anything, it would create a stronger hospital system. And like the primary reason hospitals are closing is, because people actually lack insurance, and then hospitals don't get reimbursed.
That was good point. Good conversation. Okay. Well, I would love to talk about this for another hour and a half and then talk about democratic socialism compared to socialism. But we are running out of time because we're hitting the hour mark. But what you had made the point was that this has to be a local grassroots movement, that we can't just put all of our hopes on electing one person at the national level to bring this through to fruition. And we talked a little bit about the coalition and encouraging / forcing, putting pressure on, however you want to say it, to our local politicians to support this. How specifically with things that you're working, if listeners are interested or if people want to, can they get involved at the local level to help continue this fight?
Sure. So I would say join any organization that's fighting for single-payer healthcare. I know the Democratic Progressive Caucus at Tampa Bay has endorsed Bernie Sanders, a champion of single-payer health care.
And I believe he signed on to the coalition, too.
Yes, and they're involved with the coalition. So, I mean, you could join that organization. You could join Tampa Bay Democratic Socialists of America, hardcore fighters for single payer. If you're a nurse, definitely look into joining National Nurses United. They're a union that's national, obviously. If you're a worker here in this area, you could join them at large. And I mean, I would recommend maybe joining the Tampa Bay Medicare for All Coalition, another local organization. That's a coalition of a variety of organizations fighting for single-payer healthcare. I mean, there's many ways to get involved.
How can people join or get involved or learn about the Tampa Bay Medicare for All Coalition?
Sure. So far, we only have a Facebook page and an Instagram. We may look into getting a website soon.
You have a lot of young people in your organization, don't you?
Yeah. If we go, if you go on our Facebook page, I think it's like facebook.com/Tampa Bay M4A Coalition. You can find our events. We have monthly meetings, and they're all publicly posted. Anybody can join. So you can join through that. And then at Tampa Bay DSA, we have a website. I think it's tampabaydsa.org. And then also we have a Facebook page. We post all events there. If you're interested in getting involved with DSA's Health Justice Working Group, just show up to one of the working group meetings. We meet every month.
So what's the next event coming up for the coalition?
We're hopefully going to do a film screening. The film, we haven't booked a specific date yet, but the film is called Power to Heal. And it's about the creation of Medicare and how that was conjoined with the civil rights movement. And the film is more or less about segregation and how Medicare desegregated hospitals virtually overnight. Because in the 60s, before the creation of Medicare, hospitals could segregate people based on race. Evil, nefarious, disgusting system that we had. But once Medicare was created, the federal government said to these segregated hospitals, hey, if you segregate patients on the basis of race, you're not going to get Medicare reimbursements at all. This is an evil practice. Stop. And when Medicare was created, all the hospitals are like, oh, we want that Medicare reimbursement. So fine, we're not going to segregate our hospitals anymore. And with the creation of Medicare, almost virtually overnight, hospitals were desegregated. And I think that's like the power of providing universal health care to people. So yeah, there's going to be a movie, a film screening about that.
Where?
We'll have a Q&A afterwards.
Where's that going to be?
Yeah, so we haven't booked a location just yet. But if you check the Facebook page, we're going to hopefully have that event up very soon.
And what about people who aren't necessarily joiners, but would like to influence their local politicians, whether they're represented by Kathy Castor or they're in a different district? What's the best way for people to encourage their local representatives to sign on or be proactive or support Medicare for All or universal health care single payer?
Yeah, so if you're a constituent of a politician, call their office, ask for a meeting. If they don't give you a meeting, show up to the politicians as public events, ask them questions in person, do everything that you can to try to create a dialogue between you and your representative about this issue. Write them emails, send them letters. If you just want to, work as an individual, I think that's definitely one way that you can get involved. And then also, contribute to politicians that actually support single-payer healthcare financially, if you want to do that.
Or go out and canvass for them.
Yeah. Canvassing is kind of, still not like an individual thing. You still have to socially be involved. But even in the privacy of your own home as an individual, there's a lot that you can do. There's someone primarying a politician who doesn't support single-payer healthcare, and the person who's primarying that politician does. I would encourage you to donate to that candidate.
Okay, so while we're talking about it, why do you think Kathy Castor is so hesitant to sign on this? I know originally, she had healthcare rallies right after Trump was elected. She seemed to be a big proponent of healthcare. People were really excited about that. I know that she's taken some good votes and been a good representative on other issues. And it seems like this is the one hurdle we can't seem to get her to overcome and join her constituency on. And I haven't had a conversation with her about it. So for people who have actually talked to her, what has been the hesitation, or why do you think we're having such a disconnect for her supporting Medicare for All?
So the frustrating thing is Kathy Castor is a co-founder of the Medicare for All caucus in the House. Kathy Castor previously signed on to H.R. 676, House single-payer legislation that was proposed, I believe, in 2015. So initially, Kathy Castor has presented herself as an advocate for Medicare for All, signing on to legislation, being involved in the Medicare for All caucus. Now she's not anymore. Very suspicious. So National Nurses United did some studying on Kathy Castor, and if you look at some of her financial contributors to her campaign, you'll see Cigna, you'll see Molina Healthcare, you'll see insurance companies, you'll see pharmaceutical companies. In many ways, I think that Kathy Castor has, in some sense, been bought out. And I also think that Kathy Castor is more or less going along with what Nancy Pelosi is doing. I think Kathy Castor is kind of being a liaison to Nancy Pelosi for the Tampa Bay community. And as a result, it seems like her strategic political thinking has shifted. So in my opinion, I don't think this has anything to do with Kathy Castor's ideology on this issue, because as far as I can tell, she doesn't have a consistent position on this. So my suspicion is that it's a political environment. Maybe Kathy Castor doesn't think this is a politically conducive thing to support, because she's worried about maybe re-election or doing what Nancy Pelosi and the moderate Democrats want. And then also, I think she's being influenced financially by the for-profit healthcare industry.
But what are her words when people are at her door and they're standing there with signs and saying, we're voters, we care, we want you to support this, and she's having these meetings with them? What words, because that's what I haven't been able to find, are the words that are coming out of her mouth for reasoning not supporting this?
So she claims to on behalf of her constituents be worried about the transition. She's worried that this isn't going to actually happen effectively or in a way that won't scare people away. That's kind of been the rhetoric that I've heard. So at the rally that we did not too long ago, that's more or less what her answer was. Interestingly, it wasn't like, oh, how are we going to pay for it? It's more, oh, I'm just worried about the transition, and I'm worried about what my constituents think. But the constituents that she seems to be talking about are South Tampa, not necessarily everybody else in Hillsborough.
That's generally most of the constituents that the local politicians seem to concern. And in fairness, they're the biggest voting bloc. They do show up to the polls compared to a lot of other communities, which sends the message that if you want to influence politicians, the best way to do that is to show up and vote and prove that your community is a voting bloc and will actually participate in electoral politics. My question from that is there not a way to poll your constituency and get feedback? Is there a way that Medicare for All advocates, like a coalition, can put together some kind of poll where they get feedback from the constituents in a specific district to see if that's true or not?
It would be great to do polling research in Hillsborough County. I don't know if the coalition right now necessarily has the resources to be able to do that in kind of a scientific way. And I've looked into this. I haven't, and maybe I've missed something, but I haven't seen anything for Hillsborough County in particular. But I mean, if you look statewide and nationally, Medicare for All polls extremely well. So just take the exit polls from the recent primary states, even states that were won by Joe Biden, like South Carolina. Joe Biden won in a landslide, but if you look at exit polling, more than majority of people who voted were still extremely favorable to the idea of Medicare for All single-payer healthcare. And I imagine when Florida votes, there's going to be exit polls about that, and it would be interesting to see what the results are. But my suspicion is that a solid amount, perhaps even a majority in Florida, are going to say, oh yeah, I like single-payer healthcare. So I mean, I don't know. I think it's definitely a popular idea that people connect to, and unfortunately, politicians aren't, and their actions and what they support aren't reflecting what people actually think when you poll them.
So what this leads me to wonder is if Kathy Castor can easily send a poll to her constituency through emails. I get emails from different politicians all the time. And what I would like to do is challenge Kathy Castor or challenge any of our elected officials who claim that they, understand their constituency to actually be more engaging with their constituents and send out some sort of information where they gather that, because I know I haven't been asked as a constituent in her district or a lot of the politicians' districts where I stand or what's important to me. So I think one of the ways of encouraging some of our elected officials to make sure that they're really being reflective is to make sure that they're somehow engaging with their constituency and finding that out. So I would love to challenge Kathy Castor or Vern Buchanan or whoever's in the House of Representatives. Is that locally? I don't even
Charlie
remember.
Crist would be a good
Charlie
one.
Crist, to really engage with their voters. I mean, I know through Van you can easily get emails and send out an email and find out what the voting population really wants and how much they support this issue. That's where I would see a value.
And one frustrating thing is that when Kathy Castor does public events like Q&A sessions or one-on-one meetups, which people from DSA and the coalition have been involved in, they're usually at like 9 a.m. on a Friday when most working people are at their jobs. So unfortunately, and this isn't just a Kathy Castor issue, this is just an issue for most every politician.
Absolutely.
They're not actually providing time for the public to ask them these questions, and they're not sending out surveys.
We have modern technology where we could figure this stuff out a lot easily.
Because my suspicion is because they're afraid of what the public is actually going to want. And want to say, and that's why Kathy Castor and others have these Q&A sessions with the public, so to speak, but they're at inopportune times where a lot of people can't even go.
Right.
And we're touching on another subject, and that's really dark money in politics.
Yeah.
And the fact that politicians don't worry about what their constituency, except at election time.
Exactly.
All the rest of the time, they're running after funds to get reelected.
Yeah.
And that's a huge problem that we have in our democracy at this
public
point.
Funding would
probably that's a whole nother subject.
That's a whole other podcast.
But the point being that we're not getting that representative government that we've always thought we had and should have.
That we're told from the beginning that's how our system operates.
But it's not. I mean, that, when a politician spends 70-80% of their time following money to get reelected, as opposed to meeting with their constituents, there's a problem.
Absolutely.
A big problem.
We have so many problems. And on that positive note, we're going to wrap up this podcast for the sheer sake of time. If you made it all the way to the end, thank you so much. I would love to thank Cris, our guest, for coming on and speaking so passionately and with so much knowledge on this issue. I feel so much more educated. Thank you for joining us today.
Of course, I'm happy to be here. It was a pleasure.
And thank you, Kin, for coming and making sure that this podcast happened and for being more engaged. We can't wait to hear more of your voice.
It's been a pleasure. Thank you, Jessica. And Cris, again, thank you. I think we really hopefully have helped people understand better.
Yeah, and if anyone has any questions, feel free to email me. I'll give Jessica my email.
You can say it on.
It's CRISM Carlson CARLSON @gmail.com. Feel free to email me with any questions. I'd be happy to respond at length. So.
Awesome. Right. Yeah, usually I give people more time to wrap up, but since we're running so close to the end. And thank you so much for listening to our podcast. If you ever have any questions, or suggestions, or things that you would like us to cover, you can email me personally at jvaughn, that's J, V as in Victor, AUGHN as in Nancy, 30 @gmail.com. And again, thank you for listening, and we hope you have a great day or evening or whenever you hear this. Thanks so much.